Okay, so here we're getting ready to draw some blood. We're going to do some PRP, and that is platelet-rich plasma that we'll do some injections for the vampire facial, as well as injecting a subcutaneous to get a little better result than just putting it in through the Morpheus treatment. So a little pinch, 1, 2, 3, pinch. We'll draw about 20 cc's, and that should give us about 10 cc's of plasma. Once you spin down the blood, you see the blood here, it's dark red. It tells you you're in a vein. And then when we spin the blood, what we're doing is separating the red blood cells from the plasma, because we don't want the red blood cells going in under the tissue. That causes discoloration. It also can cause some scarring. So the purer the sample, the better. Because we want to get a nice, beautiful glow when we do this process. And then we are also going to inject a little bit along the hairline to stimulate some hair growth. PRP is just amazing for just about anything in your body. A lot of sports medicine guys use it for shoulders, knees, elbows, any joint. It helps with inflammation. It helps promote collagen growth. It helps heal. It's got all the good stuff. It's got healing factors, growth factors. And that's the things that we want to target when we do this with the Morpheus or any treatment that we use PRP for. Okay, so once we take the blood, we put it into the tube. As you can see here, there's a serum separator at the bottom. So once we place it into the centrifuge, we have the speed of 4,000 rotations per minute, and we do a total time of 10 minutes. That's the average time that it takes for the complete separation of the red blood cells from the plasma. So what you see here is the beginning product. And once we finish this, I'll show you what the end product should look like and why it's so important to have a nice, clean looking serum. All right, so it's been about 35-40 minutes. That's long enough time for the medication to work and get some numbing. We tested to make sure that we have some adequate anesthetic going on. So we're going to clean it off with some alcohol prep, get the skin nice and clean and ready for the Morpheus and the injection. We just want to pay particular attention not to get anything into the eyes. And previously we were using a petroleum-based anesthetic cream, but now we went to like a lipid-soluble cream, and that seems to be doing a lot better. I feel like that lipid-soluble cream absorbs into the skin a little bit easier and a little bit faster and gives the client a much better anesthetic. It seems like the other stuff didn't penetrate as well. And it's going to take some trials if you decide to change it up. I recommend figuring out a blend that works for you. Here we do a 20% benzocaine, 8% lidocaine, and 8% tetracaine. And that seems to be the gold formula for us here. Some gauze that I previously put some water on and then put it in the freezer for a little while. So it gets it nice and cold. And we're gonna kind of just, because we're gonna inject on the hairline a little bit, we wanna make sure, even though there's anesthetic there, just because of this composition, it's always nice to have a cold application there along with the cream, so it's a lot more comfortable. Now the key for doing PRP for hair is that we go about 2 millimeters underneath the tissue, so still in the subcutaneous space, We want to get, the reason we want that depth is because that's where the hair follicle is, and we're trying to get this serum to the hair follicle and stimulate the hair growth, and also stimulates thickening of the hair shaft itself, and also neogenesis of the hair follicles. So as long as you're injecting where there already are hair follicles, that's the best place. If you inject somewhere there are no hair follicles, then there's really nothing to stimulate. Okay, we're going to do a little test here and see how it goes. Little pinch. Is that okay?
Mm-hmm.
There, you can see we're following the hairline, marching in, injecting, pulling back. You see that little wheel develop as I inject. That's just showing you that we're getting PRP there. It doesn't take a whole lot. You doing okay?
Mm-hmm.
So again, with the numbing medicine and the cold, it's really the ideal way to do it. And just take the time, make sure that we get all the areas that we need, and get a nice result. This also helps with people that are having thin hair. It helps for that thickening of the hair. So in some men and women, they might have still a considerable amount of hair, but you'll have some thinning in some areas. PRP is good for that as well. Okay, we're done with that part. That felt okay?
Mm-hmm.
You didn't even budge.
I'm an actress on one stage.
On a scale of 1 to 10, what was the pain on that?
You know, a couple over here hurt a little, but not bad.
Let me make sure.
Yeah. You do. When I've gotten Botox forever, so it's like you gotta do it. Not to mention all this IVF.
So close your eyes for me. Kind of numb that up. So if you look here, you'll see that we're going to try to target this little area here. Can you scrunch your face just a little bit and try to get rid of some of these little light wrinkles? She doesn't have a whole lot to work with, but this will help increase the collagen, give her the texture and the look that she wants in the natural way. So here, okay, close your eyes. Tell me if it hurts. Little pinch. Go ahead and inject there. And this will help with some of the crow's feet. And then when we do the Morpheus, that'll really help too. A little pinch here, because that's going to penetrate and stimulate that collagen growth along with the PRP. Again, if you look, we're not going very deep. We don't need to. This is going right into the subcutaneous space. You want to be careful right here because there's a blood vessel that runs there, so you have to make sure you stay really superficial. Okay, we hit the target areas that we want with the PRP, and then the rest we'll use when we're doing the vampire facial. Do okay?
Mm-hmm.
So here we're getting ready to start the Morpheus. We're doing single cycle, 2 millimeters of depth, and energy of 10. So on the Fitzpatrick scale, she's about a 1.5 to 2. So we can use a little bit more energy and not have to worry about hyperpigmentation. The depth is when we're working on this area here. just because we're over the bony prominence, the maximum depth we should go is 2 millimeters. Beyond that, you can start hitting bone and really be uncomfortable to the patient, and it's really not going to do anything for your results. And just so you see here, we're using the smaller head so that we can have a lot tighter control when we get to the areas that we want to work, especially around the eyes, the nose, and the lips. So slight pressure. And what's important here is to make sure that you stay in a nice, even pattern. Get a little bit of overlap, 25–30%, so you can get all the treated area. You doing okay? Mm-hmm. All right. I think it's also important, turn your head just a little bit, that we communicate with our clients to make sure they're tolerating the procedure well. Everybody says pain is beauty, or beauty is pain, but being the fact that most of my life I've spent in anesthesia, I don't necessarily buy into that rhetoric. I think it's important to have a good experience when you come here, and as little pain as possible. And as you can see here, Molly's doing a great job, not even flinching. So I'm hoping the anesthetic is working and not just her acting skills. And this area here is probably the most painful area that we do. Once we get to other areas on the face, around the cheeks, it's not as bad, because again, you have a lot of fatty deposits along your cheeks. That's what gives them that beautiful look. That's what gives you that youthful look, is when you have I call it the cherubic cheeks. Other places that have, turn your head this way a little bit, that are a little bit tender, it's usually around the ear and the jawline. Okay. Now, especially around the eyes, the same thing matters here. You have your bone ridge that comes across here. We want to make sure that we can target that area, but that we're not getting too deep. Okay, now we're going to increase the depth a little bit. We're going to go to 4, because as we get through this area here, there's a lot more tissue, so we want to stimulate it as much as we can to get that good collagen growth, and again, give you the nice fullness in the cheek area. Hit your lip line up here, okay? So when we do this, we're trying to stimulate the collagen growth here. We're trying to stay away from the lip line, because that becomes painful and there's really not any benefit for us to hit that area. We just have to be a little bit more careful in this area here. Now we're going to go to the chin. And even though you have a little bony prominence here, you still have enough tissue here that you can stick with the 4 millimeter depth without any problems. Again, pay attention to stay away from the lips. Just hit that lip line. And if you see the way that I'm pushing on the probe, you'll notice that I'm not applying a lot of pressure. Just light, firm pressure is all you need. The needles will do the rest. The great thing about Morpheus is that we can do the neck. A lot of plastic surgeons don't do anything for the neck. It's too difficult to work with. And so this is a nice way to enhance if you've had a facelift and you want your neck to kind of match your face. And you guys know what I'm talking about. You can come in, get Morpheus for your neck, get some of those wrinkles, take care of some of the hard lines, and get a nice natural look that matches your face. That is the true beauty of this Morpheus product, is that it's minimally invasive. And I'm not going to sit here and tell you that it gets plastic surgery results. Obviously, it's not going to. But depending on what you're wanting, when we do a consultation, we can tell you if we can achieve the results that you are looking for with Morpheus. The other thing with it is, the younger you start with the Morpheus, you might be able to avoid plastic surgery for a much longer period of time to achieve your look. So don't be afraid to start coming in. You know, don't wait till you're 55, 60, have a lot of sun damage, and then think that we can do a lot of magic. We can do quite a bit of magic, but definitely we need to start the process a little earlier and maybe stay away from the plastic surgery side. Nothing against plastic surgeries. I've worked for many. All right, so now we're going to go up on the energy a little bit. I'm going to decrease the depth. And we're going to hit the top forehead again with the 2 millimeters. Again, this is as much as you want to go. You increase the energy to kind of stimulate a little bit more of that collagen. And this way also, when you do 2 passes, you can make sure that if you even missed a little space, that we can get back over it. You don't have to be perfectly aligned. With the Morpheus, they have a perfect overlap because there's basically a zone. So when the needles go in and they emit the radio frequency ablation, it's not just at the very tip that the stimulation occurs. It zones out from that tip. Just think about it like a bee sting. When the bee stings you, you have one little puncture mark, but you have inflammation that occurs all around that area. In the same way, that one little puncture mark here will stimulate the area around it. And you can see here, even if you want to zoom in, see the little whitish area. Sometimes that's an area that didn't get hit as hard. So what we'll do is we pay particular attention to those. And we'll try to work with it to make sure it kind of fills in. Now, sometimes that discoloration doesn't mean it didn't get anything. It just means that it didn't inflame in the same way as other parts. The other great thing about Morpheus, it's the downtime. Unlike CO2 lasers and other things that are really aggressive, those have great results, but anybody that's had it knows your downtime is about a month. With Morpheus, 2 days. So you'll be red today, slightly red tomorrow, and by the 3rd day, barely anybody will know that you had anything done. So to me, it's like a good weekend. You come in on a Friday, you can go and work by Monday, and your friends will tell you you look amazing and want to know what changed. What did you do? You doing okay? I saw your feet wiggle a little bit. I always pay attention to the feet. They don't lie. Now, Molly's not a smoker, so you don't see very little to no lateral lines on her lips. But that's one of the things that Morpheus is really good too. When somebody smokes, or if they've been in the sun a lot and you get those lateral lines that go like this, Morpheus is great for getting rid of those. We're gonna go a little extra hard right here, just to help try to get cut down on that little neck crease that we all get over time. So I'll usually do a couple of more passes over that just to really make sure that we get some good stimulation there. And for anybody out there that's just had microneedling, it's the same process really. But with microneedling, it's not quite as effective as the Morpheus because the ablation just makes it a superior product. We're just going to apply the PRP to help with that healing, increase the collagen production, help with decreased redness and swelling over the course of today. Just make sure we rub it in. Everybody calls this a vampire facial. It sounds too Twilight-ish for me. And we've taken all the red blood cells out of it, so I'm not sure a vampire would even like this. Too bad of a joke.
I'm trying not to speak on the other side.
I gotta let my character come out, I guess. It's like, yeah, he's the guy with the bad jokes. I've never seen Twilight, but to me, vampires and werewolves should not be engaging in lustful activities.